pleased to introduce Nils Bottler, principal at Angelini Ventures. Nils, it's great to speak with you today. Where are you joining me from?
Hi, I'm joining from the heart of Berlin. I'm really lucky to work from my home office today, looking out the window and realizing it's not quite as gray and dark anymore as it used to be over the last couple months, and might be time for spring to come and get some light back in the city.
We're definitely getting there, aren't we? There's signs that spring is in the air. So, let's start with a bit about the fund itself. Tell me a bit about the fund and your role within the fund.
Sure. So before I go into the fund specifically, I would love to talk about Angelini a bit. So as you know, Angelini is a family-owned and family-run business. And the beauty of that is not only a strong dedication towards product and the choice of investment and the mission, but also a long-term commitment to innovation. Our fund is part of a diversified group of companies with roots in pharma. And if you look at healthcare, a long-term view couldn't be more important, as we ideally want to live long and healthy lives. But this important leads to complex in political and societal interests that translate to guidelines and regulation that really lengthen the process to bring innovation to market. One quick example, maybe in Germany, we have an electronic health record, an EHR, that was deemed to be a statutory health insurance benefit by the government in 2004. Yet only in 2022, patients have been able to store and view certain information in their EHRs. And I read a statement recently that the path to a holistic EHR is still described as bumpy, with a lot of patience required. Now that Angelini Ventures is structured as an evergreen fund with 300 million in commitments, we do take a long-term view on life science, biotech, and digital health investments. And I joined as a principal focused on digital healthcare. So I'm scouting for bright minds that have launched interesting and innovative companies, or are in the process of doing so, and that we can support with our knowledge network and funding.
Yeah, fantastic. And that's a great point about the electronic health records, because we do tend to see that technology is moving much quicker than the health systems can keep up with in many, many different markets. We may come back and touch on that later on. Before we dive into that, just interested to know how your career path has led you to Angelini Ventures, what you were doing before and what your journey's been.
Yeah, so I guess I'm a finance guy with somewhat of a contemporary worldview. And let me tell you what I mean by that. I started in investment banking, as most finance guys do, and it actually teaches you a great foundation. I did so at a boutique German private bank called Warburg, which has been around for 200 years and has a lot of history, takes a very traditional approach to banking, and works with very traditional businesses. I like working with various companies, but I wanted to see more innovation. So I did an MBA, moved to Berlin, and realized, to me, innovation means to challenge the status quo with new ideas and with courage. And that's what really drives my motivation. In Berlin, I joined an innovation incubator of a media company, and media was actually one of the traditional businesses that was forced to really digitize what they were doing. Otherwise, they would have gotten made irrelevant, and the space was vibrant, high pace, and fun. But after a few years, I had the chance to form a corporate venture fund for a group of hospitals. And since then, I've really found my home in healthcare investing, because I saw such a difference between, what was happening in the media industry and how fast this was happening, and where healthcare was at the same time. I was with this group of hospitals for a short time, and after the fund had been set up, I joined a boutique investment firm named Think Health in the same space that had invested successfully in ventures such as Urban Sports Club and a distribution business for medical cannabis before medical cannabis became widespread, legally available in Germany. And the whole industry arose out of that with lots of hype. So I really liked that they were early in the process. But instead of raising a large fund, we were focused on being an entrepreneurial investor and involved with our companies. I took some operational roles, with a digital therapeutics company that we had and a brick and mortar practice operator, which was great and valuable experience, but I really missed the inspiration I got from meeting with people with different innovative ideas and the ambition to bring them to market. So when I got in touch with Angelini, it was a great match, and I'm really happy to be here now.
Fantastic. What a great diverse background. I can see how all of that comes together in the work that you're doing now. And anything beyond work, I always like to ask this, anything beyond work, any passions beyond work that you see have relevance to your work now?
Sure, great question. So I've been a passionate skier since I was a kid. When I lived in Vancouver, where I went to school and university, I would spend every weekend in Whistler, the local mountain, training and racing. And a couple of years ago, I started surfing, and both are quite beneficial, I think, because it is important to switch off your mind sometimes.
Yep.
And really no better place to do so than in nature. Both take you to beautiful places around the world, yet the places you go to are very different. And in both, you have to focus 100% on where you are and actually be in touch with nature, forget the system for a while. And even if that means to sit on your surfboard for hours to catch a perfect wave, and that exactly applies to what we do professionally. We need patience, we need consistency to find spectacular opportunities.
Yeah, I love the analogy, and both obviously require good balance as well, which is quite a good skill for corporate life.
It's true.
I've tried surfing and skiing. I'm terrible at both, so we won't go into that in too much detail. Just to come back to the Angelini Ventures and what you're doing there, as you know, there's a number of corporate venture funds around. What is it that you think really makes Angelini different in that aspect?
Yeah, and that was actually one of the questions that I had for the team very early on in our initial discussions. And I think the structure is quite special. We're not part of Angelini Pharma or Vater, the consumer business, but we're part of the holding itself and have a very strong commitment from the management and with that from the family. Our team reports directly to the CEO, Sergio Marulo de Condoyani, which means we have really short communication paths and we can be quite quick in our decision making. Further, we have an advisory board that's made up of external industry experts, which I think is also quite special for corporate VCs and an important factor to have that industry knowledge in there. And yeah, the commitment, the quick decision-making ability, and this industry expertise are very important in making us a competitive investor in the market.
Fantastic. Yeah, and you know, we've spoken about your background and the diverse experience you've had. I've also seen that in some of your colleagues I've spoken to. So as you look at the team and the people that you're working with at Angelini Ventures, what is it you feel that you kind of really bring to the table there? I guess your kind of unique expertise there.
Yeah, so I mean, healthcare investments is kind of a small bubble looking at a very huge and complex field. And I'm super happy with sort of the team that Paolo Di Giorgio, our CEO, has brought together. Everybody brings local knowledge combined with a particular professional expertise and experience. So my part in that is the German perspective, and I think the financial and analytical background with some decent deal-making experience, a portfolio of over 15 companies in healthcare investments. And, you know, as my colleagues are located in Rome, Milano, Singapore, Copenhagen, and Boston, we all have this super strong local experience. The markets are very different in every geography. And the team has, you know, strong backgrounds that I have very little knowledge in, such as medical, scientific, startup operations on the large scale, and so on.
Fantastic. And you mentioned a number of locations there. We are starting to travel a little bit more now in this, what I hope is a post-COVID period. Have you got a favorite place to go when you're not in Germany?
Yeah, so I love traveling. I've been all around. Skiing and surfing does give you quite a bit of a traveling map. I think our next trip is planned to be South Africa Really looking forward to that. But if I had to pick a favorite, I think it would be a trip to Peru. My wife is from Peru, and we discovered a really nice little place in the south, quite far away from where the normal traveling path would take you. It's called Mancora, perfect little surfing spot on the beach, lots of backpackers, and quite a unique atmosphere.
Sounds amazing. I've not been to Peru, but it's somewhere I'd love to go. It always looks fantastic. Just to bring us back to Germany and Berlin, where you are now in the broader German ecosystem, it's been quite an interesting time, hasn't it, for startups and health tech innovation, quite a challenging market. But at the same time, my sense is that Germany's always been slightly ahead of the curve. So what do you see in terms of that startup environment within Germany and Berlin?
Yeah, so I mean, the German startup scene has developed very strongly over the last 2 decades, but it's also been driven by executional and operational excellence of business models that have been proven to work elsewhere. And I have a feeling also now going to Italy, where the scene is just emerging, that in other geographies, there's more courage to really challenge the status quo and take bold and sometimes unpopular views. And I think a good example of that is actually looking at the traditional German business of car manufacturers. For years, they've been ridiculing Tesla for building an electric vehicle,
Right.
and instead bet on diesel, right? Diesel is proven, we can make it more efficient. And then all of a sudden, a huge scandal arose because they've lied about how efficient diesel is. And we kind of all know where their journey has taken us now and where Tesla is today. I think there are great opportunities. And of course, the fact that we're the first European country to have a centralized reimbursement system for digital therapeutics is really good and has really sped up innovation in the digital health space. And I'm quite excited about that to see how companies manage to reach scale and build sustainable businesses. And a lot of things are happening, and hopefully it won't be so much executional excellence, but also actual innovation.
Yeah, no, great point. And that's part of why I say I think Germany's slightly ahead of the curve, is because, things like the DiGA reimbursement system hopefully is starting to really encourage more health tech to come through. And we'll see how that plays out. But there's no doubt, not just in Germany, but everywhere, there's a lot going on within the health tech space. And I guess part of your challenge is, where do you focus your time? Where do you place your bets, if you like? So do you have a view on kind of how you see Angelini Ventures most making an impact in the next 4 to 5 years or so, and where you see that impact?
Yeah, so I mean, the Angelini Pharma Group has focused on diseases of the central nervous system, which is a field that's been, I guess, a little underrepresented in terms.
Sure.
A lot of research has gone into oncology, but central nervous system diseases are very interesting. And looking at how we can combine expertise in pharma and drug development, life sciences and biotech with digital is I think is where we can make a huge impact. Now, we recently closed an investment, and I actually don't know if it's public, so I won't say the name of the company, but it is sort of a brain interface with a software component and a medtech component, an implant to treat epilepsy. Epilepsy is one of the main fields of interest for Angelini Pharma, where Angelini acquired a drug out of Switzerland 2 years ago. So bringing all of that together, I believe, is where Angelini Ventures can make an impact, both for the space of CNS and for the Angelini Group as a whole, enabling digital and other means of distributing and bringing the pharma products to the market.
Yeah, no, I completely agree. I think CNS is a particular hotbed within digital health and health technology, alongside obviously, traditional medicines. So I guess, within your typical working day or working week, you're interacting with lots and lots of different startups, lots of companies. We know from your background, you will have seen many things. What continues to inspire you within this work?
I mean, that's great about medicine tech. You're confronted with healthcare needs everywhere and all the time. And you might know someone who suffers, you hear about new methods, and you get a better understanding of what individualized and personalized medicine looks like. And, I think how closely it touches all of our personal lives and how you can see the impact in a positive way really inspires me to keep going.
Fantastic. And if we look at that kind of high level, and there's so much going on within medicine, within digital, within health tech, are there any emerging trends within healthcare or digital that you think are really interesting and worth following closely?
Yeah, so I really like the idea of digital drugs. Most digital therapeutics that we have today and that have clinical validation are digital forms of some therapy that has worked in the real life setting, such as cognitive behavioral therapy for most digital therapeutics that we have on the market. But research shows that there is more that we can do and actually treat through influencing our sensory organs in some sort of way. This could be audio files using beats and sounds played at slightly different frequencies in each ear to induce a certain state of mind, relaxation, euphoria, altered states of consciousness, and actually treat certain indications similar to how a drug would do so.
Yep.
And I think, the path to market and clinical validation is a lot longer than taking cognitive behavioral therapy, but that is one of these emerging trends that I am really excited to take a look at in the future.
Really interesting, yeah. And as you know, I mean, there's so much going on within CBT, within digital health. But to your point, I think we're just starting to understand the impact of these kind of sensory applications. It'll be a fascinating field to follow. So let me bring you back to this year, because as we record this, we're almost at the end of February 2023. Any predictions specifically for this year that you're really excited about, or things you think people should focus on?
With Angelini, I'm here to invest in digital health. So I think digital health is something very interesting. DIGA was introduced 2 years ago, yet no company has really managed to achieve significant scale. I don't think that is a problem of the system itself, but rather a challenge on how to tackle the market, how to best go to market. I will definitely be taking a close look at some of the DIGA companies, and new markets are becoming available for digital therapeutics. COVID has sped everything up, but as we all know, it takes time for these things to become available on a wide scale. France might be introducing their system for digital reimbursement this year. The US has done a lot. Various states are including digital therapeutics in their Medicaid programs. I think we've seen sort of a hype over the last 2 years, which resulted in crazy valuations. Now that has all come down to represent where the company actually stands in the market environment and in terms of scalability and revenues they can achieve. And that might lead to some good opportunities for investment now and actually scaling digital therapeutic businesses and bringing them to a wider portion of the population.
Yeah, that's a great observation. And as we touched on, I mean, the innovation is out there. And then in markets like Germany, you have the reimbursement system. Perhaps it's now about seeing that behavior change and this start to be embedded more within health practice. That's a good ambition to hope for within 2023. Well, look, Nils, it's been fascinating speaking with you. Thank you so much for taking the time, and obviously wish you continued success in your work with Angelini Ventures.
Thanks a lot, Paul. It was a pleasure speaking to you.